Hey guys, welcome to our channel, Med Dent School. Today's video is about the dental forceps. Alright, so there are parts of dental forceps. We have the beaks, joint, and handle. Joint or hinge. It has two names. Alright, so there are multiple types of forceps depending on the tooth you want to extract. The first one, there are ones for the upper teeth and ones for the lower teeth. The upper teeth are mostly like straight, and the lower teeth has an angle like a 90-degree angle. So lower teeth, L-shaped forceps. Remember as this. Alright, so we have upper straight forceps. It is straight as you see. It's called straight because the handle, the joint, and the blades are in the same line. Alright, so we have fine blades and heavy blades. Fine blades for lateral incisors and upper anterior retained roots, and the heavy for the central incisors of the canine, depending on the size of the tooth. Small tooth or roots, use the fine blades. Big roots, big tooth, use the big tooth, use the heavy blades. Alright. The same is used for right and left. And for the premolar, it has two bends as you see. The first one is to apply the forceps parallel to the long axis of the tooth, so as not to cause fracture of the tooth. And the second one is so as not to cause injury to the lower lip and the lower teeth. So the difference between them, this one is straight and this one has two bends. Alright, the blades are identical. The same forceps is used for right and left. As you see here, it's rounded blades. The third type is the upper molar forceps, full crown upper molar forceps. This type, we have one for left and one for right, depends on the where the projection is. So the blade has two blades. One is rounded and the other one has projection. The reason for that is that the upper molar teeth has three three roots, two buccal roots and one palatal. Alright, so this projection is for the bifurcation area here between the two buccal roots. Alright, and the palatal root, as we see here, there's no projection, it's rounded here to fit in this area. Alright, so you cut the tooth really well and you have a better control of the tooth. That's why they designed it like this. And it has two bends as well, so that the force is applied parallel to the long axis of the tooth, and the second one is so as not to cause injury to the lower lip and the lower teeth. Right? And finally, we have bayonet forceps for the upper third molar. It does not have any projection, grounded here and here. And we have two types, one for the upper posterior roots and one for upper third molar. Alright, and as we see, it has like this, like some elongation in this area. That's how you know this one is for the upper third molar. It's the only type that has this projection, this elongation, and there's elongation here as well. This one is for the upper posterior roots. Whenever we have a posterior roots, like let's say the palatal roots of maybe like upper six or something, some retained roots, we can use this type of forceps. Upper posterior remaining from the forceps, and as we see here, the blades look like this. And now with the lower forceps for extraction of lower central and lateral incisors and canines. There are also fine blades and heavy blades. The fine blades for the smaller teeth, with the lower and central lateral incisors and the lower retained roots. The heavy blades for the extraction of canines, and there is no space between the blades. And why we say that, because here the lower premolar forceps, it has a space between the blades. All right, so first when you see forceps, first you check if it is in a straight line or it has like a 90-degree angle. Number two, if you see it has a 90-degree angle, you check, does it have a space here or not? If it has a space, that means this one is for the upper premolar forceps, the lower premolar forceps. No projection here and there, and it has a space in here. This is for the premolar. No space. This is for the lower anterior teeth. The reason they made space is that because the lower premolars have a buccolingual width greater than the lower incisors of canines, so as not to cause crushing of the tooth, the crown of the teeth, they designed it like this. They left some space here. As we see here, the blades are rounded, and there is a space between them, and the same forceps are used for right and left. The lower molar forceps, full crown lower molar, it has two beaks, as we see here. The reason for that is that we have two roots. The lower molars have two roots, one the mesial and one distal. So we have two beaks, one for the buccal bifurcation area, the buccal side, and another one for the bifurcation area and the lingual side. So we get a better catch of the tooth and better control of it. They designed it like this. And the same forceps are used for the lower left and right side, as we see here. Two projection, both have projection, same forceps for right and left. Projection here and there, and 90-degree as well. Bayonet forceps for lower third molars. You see it has a specific design. All right, one for right, one for left, and this is physics forceps. It has a specific technique of extraction, and this one is bumper guards. All right, this one for the left and this one for the right. And now just for the technique, as a simple explanation, we have the dominant hand and the non-dominant hand. The dominant hand is the one we mostly use. Most people use the right hand. Right, so this is the dominant. You use it for catching or handling of the forceps. And the non-dominant hand, we use it for retraction and support. These are pictures of how you do a retraction and support with the non-dominant hand, and this one is how to handle the forceps with the dominant hand. And these are pictures of the application and which one is correct and which one is wrong. So basically, you need to get a better grasp of the tooth. You need to put the beaks on the roots, not on the crown. You can't put it in here. You're gonna crush the tooth. The forceps might split. It might slip from this area, and this is not gonna work. First, you gotta luxate the area with luxators. You need to cut the PDL ligaments. You get some space, you make some space for the beaks, then you put the beaks as deep as possible on the roots to get a better catch. The deeper the better. So this area, this point, as you see here, is located. It's gonna locate much thickly, which is better. Thanks for watching this video. Don't forget to like, subscribe,